Hello, and welcome to this presentation on psychiatric aspects of hypertension and heart failure. 1 in 3 individuals with hypertension or other cardiovascular disease have depression. And new research has shown that several common antihypertensives, drugs that are beta blockers, drugs that act on angiotensin receptor system, calcium channel blockers, are associated with modest reduced risk of hypertension over 10 years. My guess is that they're improving brain health, and so the vascular component of depression or vascular depression is less. This research did not find the same thing with diuretics, which are often used to manage hypertension. Depression is also prevalent in individuals with chronic heart failure. And management of heart failure is now very complex and may involve de-prescribing diuretics. This is by Dr. Meenakshi Patel, a geriatrician. It's important to recognize the complexity so that managing heart failure better may improve actually a lot of anxiety and depression which can happen due to heart failure. Also, many older adults have implantable cardioverter defibrillator, ICD, and even the discussion about when to deactivate it needs to happen not only routinely, but as early as possible and then periodically thereafter. Unfortunately, fewer than 45% of ICDs are deactivated even after our patients have chosen DNR, do not resuscitate. So it's important to really have these difficult discussions. Psychiatrists can play a key role in working with primary care team, the family, and the patient to not only optimally treat anxiety and depression, especially without medicines, for example, individual counseling, physical exercise activity, music therapy, behavioral activation therapy, repetitive transcranial magnetic stimulation therapy, bright light therapy. All these are evidence-based treatments. Now we have relaxation meditation apps from Cleveland Clinic Wellness, UCLA, that can help reduce anxiety, and we can avoid psychiatric medicines. Rational de-prescribing of psychiatric medicines that negatively interact with cardiovascular medications and heart health is also important. Many medicines can cause low sodium by interacting with diuretics. Many psychiatric medicines can cause orthostatic hypertension, cardiac arrhythmias, even sudden cardiac death. So it's important to keep all this complexity in mind. And last but not the least, psychiatrists can play a key role in having difficult conversations about end-of-life care, especially for older adults who have cognitive impairment and depression. So let's keep all these things in mind. I recommend the book written by my mentor, Dr. George Grossberg. He's nationally and internationally renowned geriatric psychiatrist. And we have a chapter on rational de-prescribing and another chapter on palliative and hospice medicine. Hope this has been useful. Namaste.